Okay, so when you're assessing for rib mobility in the thoracic spine, you're going to want to try and assess it with thoracic motion as well as with deep breathing. And you don't really necessarily go right to rib mobility every time you have anybody with mid-back pain. This is usually a diagnosis by exclusion, so you're going to rule out cervical spine issues, you're going to rule out the shoulder, and you're going to rule out facet joint issues before you're really ruling in a rib dysfunction of any kind. So when you're assessing the mobility, you're going to start by trying to find the rib angles of whichever area the person's having pain. So if they're having posterior rib dysfunction or you're suspecting that, sometimes it's best to kind of have them bring their arms across themselves in the front so it clears those scapula out of the way. And you can kind of dig in there and find those rib angles. I like to kind of splay my fingers out to the side in those intervertebral intercostal spaces, I mean to say, and then I'm going to have them take a couple deep breaths. Good. And you want to have them take a few breaths because it can kind of vary between breaths. And you want to look for symmetrical motion here from side to side. And you're going to want to look at a few segments. So let them kind of rest for a second, move down to the next couple rib angles, and assess again. Now there's actual measurements you can probably look up on how many centimeters that's supposed to actually translate to the side. But realistically, you can just look for symmetry between the two and whether or not that's reproducing their rib angle pain. You can also get anterior rib dysfunction or costochondritis. That's a little more difficult to assess, so I'll show you guys that in a second.